Before you start to increase your child's ADHD medications, there are 5 alternatives that I would like to share with you that can be just as effective and sometimes even more effective than medications or even lower doses. And I'm going to share exactly how to use them. So listen up. Hi, I'm Danielle Orr. I am a psychiatric mental health nurse practitioner and a functional psychiatry coach and a family nurse practitioner. And I want to be clear from the start, I am not anti-medication. I don't want you to think that I prescribe medication frequently. However, I know that there are alternatives out there that can really help our children almost as effective as medication. So I'm here to break that down for you. Medications can be life-changing in some children, but what frustrates me is that most families are never offered or never even told about other supplements or ways that they can help their child thrive without medication or even on just lower doses of things. Today, I'm going to share 5 natural interventions that are backed by research that I use in my practice to help kiddos with ADHD, and it helps them focus better, regulate their emotions, and really be successful and succeed in school. So listen up. Alternative number 1 to medication for ADHD is targeted nutrient therapy. We're going to talk about how to get some of our nutrients in check so that we can help our kiddos, right? So the first and the most powerful alternate targeted nutrient therapy is I'm not talking like our basic vitamin, multivitamin. I'm talking about addressing the specific deficiencies that our kiddos have that can create ADHD symptoms. So if they're deficient in a certain nutrient, it can actually mimic ADHD symptoms. And if we get those balanced out, their symptoms decrease or maybe even go away. So the first one I'm talking about is magnesium. You've heard me talk about it before. Magnesium is so important in our brain. It's used in so many different ways in our body. Research has shown that kiddos with ADHD are deficient in magnesium. So what that tells us is that when they're deficient in magnesium, they're having issues with their dopamine. When you're talking about ADHD, you have dopamine issues there. So magnesium is helping your neurotransmitters balance out and it's calming the nervous system. A lot of my kiddos will have ADHD symptoms, which also look like anxiety. And that's because their magnesium is not balanced out. And so it's really important that we keep an eye on that. A 2017 study found that magnesium supplementation significantly improved hyperactivity, impulsivity, and attention in children with ADHD. But here's the key. Not all magnesium is equal. I don't know about you, but I have this conversation a lot with my parents and tell them that there's so many different types of magnesium, right? Which one do we use? So magnesium glycinate or magnesium threonate actually crosses that blood-brain barrier, which means that it gets into your brain and is used more appropriately and more effective than other forms of magnesium. A lot of times I hear, oh, well, magnesium's making them poop. Certain magnesium will, yes, but if you use that one that actually gets into their brain, they're going to be more successful with that. So the next one is omega-3 fatty acids. Multiple studies have shown that omega-3 supplementation, it improves ADHD medication management and ADHD symptoms. And so your brain, I'm sure you know this, or maybe you don't know this, but your child's brain is 60% fat, 60. And it needs high quality omega-3s to help build those healthy brain cells so that they can get their neurotransmitters, receptors working appropriately so they can bring in the things that they need to help calm their brain down. So the research is actually showing that you need therapeutic doses of omega-3 fatty acids of generally between 1,000 to 2,000 of combined EPA and DHA daily. If you look at your kid's gummy that you have in the cabinet, I guarantee they don't have enough of that in there because that's typically not the amount that's in there. So there's been a lot of studies that have really shown high doses of omega-3 helping. I've actually used it throughout my years, even with medication supplementation, and it's been very, very helpful. There's actually some protocols that do follow this, which is amazing. So the third one is zinc. And we've talked about zinc before. I've done other videos on it. Zinc is super important when it comes to our dopamine production and the regulation of dopamine. And I don't know if you're hearing like a common theme here, but like dopamine, ADHD symptoms, we're going to see a lot of that. You'll hear me talk about kiddos that are dopamine seeking and what that looks like. Maybe our kids that eat a lot, because when you're eating, chewing, it actually increases your dopamine, and your kiddos are dopamine seeking and snacking a lot. And so parents are like, oh, I didn't even think about that. You get your ADHD under control and then they stop snacking as much. Interesting. So let's get back to zinc. Studies have actually shown that children with ADHD often have significantly lower zinc levels. Talked about this before. When you're doing zinc supplementation with kiddos, it can improve their attention and reduce their hyperactivity. It also helps with their immune system. So it's kind of a multiple effect type of supplement, but there's lots of different things that it can help with. And so the next one that we want to talk about is iron. There's a whole other slew of that. We'll talk about our preteen girls that are needing the iron supplementation, especially as they're getting into their menstrual cycle. However, we don't really think about iron in kids in general. I know that, long ago, they're like when they were younger, their pediatrician would like check their iron levels and things like that, but they don't really do it as much as they get older. So it's really important because even if they're normal by standard testing, they actually might have like a functional iron deficiency, which sounds kind of weird. If you actually think about how the standard testing is, standard lab draw testing, standard the finger poke testing, it looks at a standard of kiddos. It's not looking at your child at their actual deeper levels of things and how their body is interworking with other stuff in their system. And so when you're looking at it from a functional level, really, when there's a ferritin level below 50, it can be associated with ADHD symptoms. And doctors don't really get concerned, like your PCP, until their ferritin levels are below 15. So do you hear a difference there? So under 50 can cause ADHD symptoms, but our PCPs don't get worried until 15 because they're worried about iron deficiency. So me in my world, I worry about it higher levels because then if it's deficient, we're going to be having these symptoms. We adjust it, we feel better. Wow, this is super cool, right? Not needing medication. And another reason the iron is super important, again, it is crucial for dopamine. It's crucial for the dopamine synthesis because what happens is low iron equals low dopamine, and bingo, ADHD symptoms happen, right? Like, I mean, I think you probably knew I was going to tell you that. So let me tell you about a kiddo that I had, a 9-year-old patient that I was taking care of previously. We're like, should we start stimulant medication? Like, what should we do with them? And so I encouraged the parents because they weren't really on board with medication. No problem. Love that. Love the parents that do not want to do medication as a first line. Like, let's find out other things we can do. So we tested him and found that his ferritin was technically normal in the between the 15 and the 50 range. And it was technically normal. His pediatrician was like, yeah, it's normal. But it wasn't in the functionally insufficient area is where it was. And so we brought up his iron levels and addressing the other things that were going on. We used omega-3s and we used magnesium. And within a couple of months, his teacher actually reported that she was like, do you guys have him on medication? Like, what's going on? And the parents were like, no, like we just kind of changed up his diet and his vitamins and he's doing much better. And they were so happy and thrilled that we didn't actually have to start stimulant medication, that we were able to just address things from a nutrient level and find as much success versus starting a stimulant. And that has been something they were super thankful for. And I was super happy to share that journey with them. Just some examples of how it can help by getting some of your nutrients figured out. Alternative number 2, ADHD symptoms without medication. So the second one is dietary modification. And I'm going to give you some specifics because you hear that, oh, cut this out, cut that out, all these things, or just eat healthy and you'll be fine. And that doesn't really help. You need like those specifics, right? And so obviously you want to work with your provider, but I'm going to give you some ideas of how to work with that. So removing food dyes. Multiple studies have shown with research and even published out there that artificial food dyes actually significantly increase and worsen our ADHD symptoms in our kiddos. And we're talking like red dye 40, yellow 5. And one of those things, it's really important. And let's not forget like the blue dye number 1. These things are in cereal, they're in yogurts, they're in medications, they're in everything that our kids consume, fruit snacks, all of these things. And so something to think about is that over in Europe, because we're here in the US, they actually require warning labels in Europe on foods that have artificial dyes because of their effect on attention and behavior. Like, let's think about that for a second. The US does not put these alerts on there, but that doesn't mean that they're safe. And there is a lot of things kind of going on right now in the news about, I actually just heard a study yesterday on the radio about challenging, should we be labeling these things in our food and are they safe? And I mean, if other countries are not allowing them or requiring them to be labeled a certain way, like that should tell us something. And we should be concerned. Like, just throwing that out there, we should really be concerned about that. Something else that's really important is identifying food sensitivities. So there has been plenty of research that shows that food sensitivities can actually cause ADHD-like symptoms because what's happening is they are going through the inflammatory pathways and it's causing that irritation, agitation, irritability internally. And so it seems like maybe some irritation or some ADHD symptoms when in reality, it's that kids are sensitive to certain things that they're eating. The most common things that I see is gluten or dairy or soy or corn and even eggs. Those are the most common sensitivities. And I'm not saying that every single child needs to avoid this forever. That's not what I'm saying. But sometimes we do temporarily remove those food triggers and see if it can be transformative because a lot of times we slowly bring them back in as time goes on. And this is something that I work with extensively in my program. So it's really important to realize that there are things that you can do, but it's not that it's going to be a forever thing. It could possibly be, but you got to get that inflammation down in your body in order to build it back up. So I've actually seen kiddos by doing some of this elimination in their diet go from failing in school to honor roll just by kind of like reducing and making those inflammatory foods go away. Because remember, in my previous videos, the inflammation that you have in your gut actually leads up to your brain. So if we're decreasing our gut inflammation, we're therefore decreasing our brain inflammation, which means that we're going to be having less symptoms. We're going to be having to not fight our bodies so much on focusing and attention. And so that's really important. Another thing that we talk about a lot of times is stabilizing blood sugar. Hangry. I literally had a patient yesterday that I was seeing and just very kind of sassy with mom and hiding from me and like didn't want to talk and all these things. And I said, "Hey, buddy, what did you eat today?" And the answer, long and short, was that he hadn't eaten in several hours. The last thing that he ate was a bunch of sugar. So we have to think about this. When our blood sugar is spiking and crashes, it can look exactly like ADHD symptoms, which is like the inability to focus, the irritability, the hyperactivity, and then it follows by this huge crash, right? And so many kiddos will eat high carbs throughout the day, low protein breakfast, high sugary breakfast, and then it's just setting them up for blood sugar dysregulation all day long, right? They're starting their morning off with a sugary cereal, a Pop-Tart, things like that. And their body just has nothing to go on. And so we're not mixing in a good breakfast for them to start them off on the right foot. They're crashing mid-morning, they're having behaviors. All of these things happen that we don't really want to happen with our kiddos, but we can start to prevent some of that by giving them a good breakfast morning. So something that we also look at is if we can start adding in a protein and a healthy fat instead of like that cereal and juice, it can dramatically improve their focus and their emotional regulation throughout the day, which is fantastic. And I'm sure the teachers would appreciate seeing some of that in their kiddos. And the last little bit is increasing the nutrient density in our kiddos. We need to focus on like addition, like what can we add into our kiddos? So I always try with my kiddos, like what can we add in as far as a vegetable or a fruit or things that are just good for our body with the food that they want for dinner. And that's fine. So we can add in like leafy greens or berries because berries are really great for your brain. I know I've talked about blueberries before. Things like trading out fish for like a wild caught fish or eggs that come from like your local chicken farmer, nuts and seeds. And really these things, these foods are nutrient that our brain needs to make those neurotransmitters regulate our attention. And so if we're giving our kids these foods that aren't full of just additives and dyes and just junk, basically, you're going to see a better change in your mood. And I will tell you what, I do this with my kiddos when they try to eat those junk food or things along those lines. I see a lot more behaviors with them. So it's really one of those things that it's not just, well, it's because your mom said kind of thing. It really is a proven fact that our kiddos do, that they struggle. And if we can actually get them to eat a little bit better, because the American diet, and I've talked about this before, it's not nutrient filled. I mean, it's called the SAD diet. People joke about that. It's a standard American diet. It's not great. So really just keeping in mind that we need to help our kiddos is going to be super important. So alternate number 3, if you've watched my other videos, you knew I was going to talk about this one, but the gut microbiome support. Again, I've talked about this before. I have a whole video series on it. Super important because guess what? It comes up with our ADHD kiddos too. So the third alternate is the gut-brain axis support. We talked about how your gut is essentially your second brain. And if you want to go back, you can look at my other video as far as that goes, because there is a huge component to that, but it's also crucial for ADHD. So research has actually shown in the frontiers of psychiatry that children with ADHD have a significant different gut bacteria compared to those with like a neurotypical child. And so when they're looking at the gut bacteria and the gut lining of our kiddos with ADHD, they look a little bit different than those that don't have ADHD, our neurotypical kiddos. Because what happens is their gut microbiome is actually more inflamed and has more inflammatory species. And this can actually lower, and they have like fewer of the beneficial species that produce our neurotransmitters. So their gut's inflamed, which means their brain is inflamed, and they don't have enough of those healthy species in their gut that can actually give them those neurotransmitters that are needing to calm their brain down, to calm down their focus, to increase their focus, calm down their hyperactivity. Those are really important. So studies have actually shown that using specific probiotic strains have shown improvement in attention spans, hyperactivity levels, impulsivity, emotional regulation, all of the things that are ADHD symptoms. Sound familiar? So the key to using the right strains is making sure that you're finding good strains, not just some, hey, this is a probiotic kind of thing. So we really want to make sure that we are using things that have the lactobacillus in them, And really just the soil-based ones are a lot more important to use with our kiddos because they are more beneficial for them. But remember though too, is that probiotics are not just enough alone. You actually have to also use that in combination with the removing the inflammatory foods because that's going to help it heal the intestine permeability. So what happens is, okay, cool, I took my probiotic. I'm still eating junk food. I'm still eating all these things, inflammatory foods. Like, why are you wasting money on probiotics? Because you're not actually helping things along. You're kind of sort of like halfway helping, but not really. So just keep that in mind. And then also making sure that we're supporting the beneficial bacteria with any of our prebiotic fibers. And so you hear about probiotics, but you need the things that help digest the food before you eat it. And then really addressing any underlying gut issues or gut infections that you have. And again, I'm not anti-medication, but antibiotics, remember, they do definitely tear up your gut lining for a long time. So you have to get that back in check so that you're feeling a little bit better. And so that things are getting better as far as the just in general wanting to, digest food properly, having less inflammation and things like that. And so there was this time I worked with a 7-year-old boy who actually was on medication for ADHD for 2 years before I saw him with like just really minimal improvement. And so when we did some testing, some functional testing, which again, PCPs don't do, it actually showed that he had severe gut dysbiosis. So, which is just kind of that leaky gut, right? And he basically had a gut that was like, hey, I need help. I'm inflamed. I've got a lot going on here and I'm not properly digesting my nutrients that I need, right? And so really we were able to heal his gut over the 6 months that we were working together. And we actually were able to decrease his medication use by 75% because his symptoms really just improved so dramatically. So when I'm talking about that gut microbiome access and the fact that our gut really plays into everything else, it's so important that we heal from the inside so that we can have things work correctly on the outside. So just remember that when you're thinking about how do we kind of decrease some of the inflammation in our gut, it's an undertaking, but it can be done. And it doesn't have to be done overnight because it didn't get that way overnight either. So just keep that in mind. All right, so if you're still with me, we're on number 4 for the alternative to ADHD medication. And this one is going to be neurofeedback and cognitive training. And so what that is it's kind of just like retraining our brain, basically. The research on this is really compelling. It's something that is interesting to see when you actually look into how different things can heal your brain. So the neurofeedback trains your brain to better regulate itself, right? And so it's an exercise for your brain. And multiple studies have actually shown that the feedback that is done with the neurofeedback, it can actually improve attention, reduce hyperactivity, and enhance executive functioning in children. So if you've heard me talk about kiddos, executive functioning is not there with our kiddos. It's that, hey, is this going to be a good idea? Consequence, benefits of when I do something, they just don't have that forward thinking. And that's normal on our kids and really until they're young adults. But it's one of those things where it does help to kind of increase that. And so in 2016, there was actually a meta-analysis that found that neurofeedback actually produces the results comparable to stimulant medications. And with that, their long-term effects of kind of just basically retraining your brain have been, chemically altering, and it does last throughout a kiddo's lifetime into an adulthood. And so something to remember though, is that the typical protocol is usually 30 to 40 sessions, and it does require an investment of time and money up front. But remember, those results can be permanent, which would be amazing if you can help retrain your brain and do that exercise, and it can be lifelong, which is awesome. Because what happens is our working memory is actually another evidence-based intervention to work on the training piece of it. So when we're doing the working memory training, it can help do wonderful things to help your brain just kind of reset itself and go, okay, I know that this is happening right now, but how do I not go over the edge, or how do I kind of calm down the symptoms of feeling overwhelmed? There are some programs out there like CogMed that the research has shown that it actually does help with inattention and increases executive functioning even after that training has ended. So it's definitely something to think about, something to look into. It's not something that I offer, but it's something that's super helpful and has a lot of research to back it up. All right, number 5, alternate to medication. So lifestyle optimization. This is one that a lot of people say they want to do, but when it comes down to the nitty gritty, it's hard to do, but it's so worth it. So comprehensive lifestyle optimization, I can't even say the word. It's important because it is a lot of work. It's one of those things where you're changing a lifestyle, right? And by doing so, you're actually causing your lifestyle to have permanent changes, and it's super powerful. So it doesn't take a lot when you think about it, but it just takes consistency, and you have to just be committed to it in order for it to make a difference, because you're not going to see a difference if you don't make that commitment, right? And so the biggest one of that is sleep. We've talked about sleep before. So a lot of times people will say that sleep deprivation actually looks like ADHD, right? You don't sleep, you start to have symptoms of ADHD and inattention, irritability, agitation, focus issues. And a lot of kiddos that I see, when I talk about how are things going, how are you sleeping at night? Okay, what time are you going to bed? What time are you waking up? How long does it take you to fall asleep? Because a lot of these times, our kiddos with ADHD actually have underlying sleep issues. They have like a delayed sleep phase, they have sleep apnea, they may have like restless leg syndrome, or just simply like insufficient sleep. And so sleep studies can be very helpful with that, because it can tell us like what's going on with their actual sleep and how they are sleeping. And research actually shows that improving your sleep quality and duration can actually reduce your ADHD symptoms by up to 50%. And that is amazing, because that's like medication level improvement from fixing sleep, right? So 30 to 50% of fixing your symptoms just from simply sleeping better or going to sleep a little bit easier or talking about sleep hygiene, working on sleep hygiene is super important. Something else that we don't think about with our kiddos that's also very incredibly important is movement. We want to make sure that our kids are getting enough movement. I talk about this a lot in my appointments, and making sure that our kids are getting exercise, that they're staying active, that they are just really moving their body and kind of challenging their body. Because if they don't, what ends up happening is that they've got all this extra energy before bed and they can't go to sleep, right? And so then it starts the sleep issue, which then it just creates this whole entire cycle. Because exercise is actually proven to increase dopamine, norepinephrine, and brain derived factors, which is basically like all the things of ADHD and the symptoms, but it does it naturally. And so studies have actually shown that even 30 to 40 minutes of an exercise or moderate to vigorous movement, whether that be a sport or karate or taekwondo or jujitsu or running or whatever it may be, swimming, this can actually help. Even if they do it before school, if possible, it actually increases their focus throughout the day. So I actually had a kiddo yesterday that I was working with, and he was doing wrestling in the morning before school. And mom and the kiddo told me that he was doing much better with focusing throughout the day when he had this like routine and this regimen where he was doing this wrestling before school, and he was able to focus more throughout his day. And it's so important. Or I'll talk about even movement before you want your kiddo to do homework, or movement before you want them to sit at the dinner table, because you really got to engage that part of your brain where it's like, okay, I'm getting the wiggles out, I'm getting the movement that I need out so I can sit and focus on something. It's so proven, and it's so important for our kiddos to get that movement. My next favorite one is reduce screen time. If you're a client of mine, you probably hear me say this a ton, and parents are usually, I agree, you're right, Danielle, you got this. Kids usually hate it, which I'm sorry, my own daughter does too, but it just is what it is. The research shows it's screen time is just a mess for our kiddo's brain. And as society has changed over the last multiple years, it is becoming more of an issue for our kids, because excessive screen time and those fast-paced video games and social media and things like that, where you're getting that like instant gratification, is actually worsening your ADHD symptoms. So what happens is, and I've talked about this before, you wake up in the morning, you've got your bucket full of dopamine, and then it's depleting these dopamine receptors throughout our brain, especially if we're getting on video games in the morning before school, right? And so what happens is this overstimulation, this instant gratification to things, actually is depleting the dopamine receptors, and it's reducing our attention span. And so do you ever get that kiddo that's on a video game, they get off and they are just cranky and snappy and just irritated, or you hear them on the video game and they're playing with other people and they're just yelling and or I've had kids like break things when they're playing video games because they just get so intense with things. So it's really important that we are really not overstimulating our kids' brains, because they have that dopamine bucket. And that, I mean, you essentially just go in and just pour it out when you're giving them a video game or any kind of electronic device, because, or social media or any of those things. And that whole social media is a whole other story we could talk about, but you're just dumping things out and then you're expecting your kid to behave. Like, that's not going to happen, but you can continue to try. It's not going to happen unless you actually reduce the stimulus that they're having, which is that video game. Again, something that my kids argue with me a lot about, even my own daughter, but it is what it is. The research proves it. So something that's also super important is the nature exposure. Research actually shows that spending time in nature, or instead of like screen time, they call it green time, can improve your attention and reduces your hyperactivity in your kiddos with ADHD. Get them in the park for 20 minutes. Get them outside. I know where we're at in Arizona, it's hard to do that in the summertime. I completely understand that. Get them in the pool, do something. But it's so important to get them connected to things that are not screen time, to get them some natural light, to get them really just being part of the world versus just the screen right in front of them. I can't even tell you, like, even with my own son recently, who's been hospitalized a lot because he has cancer, when we were able to get him out of the hospital and get him home and get his feet in the grass, like, no joke, this sense of calm just came over him when he had his feet in the grass. And it was the coolest thing to see. I wish I had filmed it because it was literally, you could just like see the calm come over him. And so it's so important to connect. If you're having a bad day, get out there, put your feet in the grass. Just go take a walk before dinner. Just try to decompress. This leads me to the next one, which is stress reduction. So chronic stress actually worsens our ADHD symptoms, right? So we're chronically stressed. Our brain is on overload. Really teaching our kiddos stress management is going to be really important. And kids, it looks different than adults, right? And so this isn't like, oh, you need to do this to help reduce your stress, or you're having like a work commitment or things along those lines. To reduce their stress levels, you need to teach them about like breathing techniques or being mindful, or even just like the simple relaxation can just kind of help improve their self-regulation. And so what happens is our kids just really start to feel overwhelmed. They don't know what to do. And so I remind them, hey, do some simple techniques. Let's just take some slow breaths. Nobody has to know that you're doing it in your classroom. You can just sit there and just do some simple things. You can do some finger breathing. You can do things like that that can help calm your body down without people like knowing what's going on, or, oh my gosh, they're over there doing stress relief. So just really remembering those things are important. I talked about a lot of different things, right? Give you 5 different things to think about. And what I like to remind people is that combining approaches is generally the best, right? And so here's what's really important to understand. These aren't like choices or like things that you can kind of pick and choose from. The most powerful thing I will say is anytime that you combine something that's going to be helpful for your child. So maybe a little bit of column A, column B, those kind of things. And the more that you are able to like combine different things, it's going to be more beneficial for your child. Everybody's different. So really just kind of remembering, okay, I need to take a little bit of this for my kiddo, or let's get them out, and maybe they don't like karate or jujitsu or things like that. And maybe that we can get them into swimming or some other kind of physical activity. So just kind of ebb and flow with it. But you definitely want to work with doing things in combination, not just one specific thing, because if your stress level is better, but then you're sleeping like junk, you're going to end up being stressed out because they're not sleeping well, right? And so you have to really kind of balance them out. And so really just a lot of times I have parents that are just like, hey, I feel super stuck. I don't know kind of like what to do. We're kind of max on a medication. What do we do? And so I'll do a comprehensive approach where I'm looking at different testing, deficiencies as far as their nutrients, correct those, talk about things that we are working on as far as their stress levels, working on their gut dysfunction, optimize sleep, getting plenty of exercise, making sure that we are looking at food sensitivities that are causing inflammation. And by doing all of those things in combination over time, it helps decrease stuff, and it helps decrease their inattention and their focus concerns, and maybe some of their emotional dysregulation, and just generally happy kiddo. Like, hey, I don't feel as grumpy and irritated. And that's what we want, right? We want our kiddos to feel like they can thrive academically and socially and emotionally. The world is a hard enough place. We don't need to continue to make it harder for them. So whatever we can do to help regulate them is so super important. And when we're looking at the root causes, this is kind of what I get into of like, hey, let's look at these different things that are able to help our kiddos heal versus just continuing to throw medication and basically just putting a Band-Aid on them. Again, I'm not anti-medication. However, we need to really think about how we can best help our kiddos. So something I also want to remind you guys of is make sure that before you're trying these alternatives, these are just some really important points to give. I want you to make sure that you're working with a qualified practitioner, somebody that understands the functional approach, because implementing these different intervention, and if you don't do it properly, it can actually be harmful. And so you need to make sure that you have someone that has the expertise and is often testing to identify like what your child specifically needs instead of just using a blanket protocol, because those are not successful. Don't stop medication. Don't do it unless you have medical supervision. If your child is working with a provider and they're currently getting medication, talk to them. Tell them, hey, I want to try some alternatives with my child. And I want to do this as like a comprehensive approach. And that is something that hopefully your provider is open to. I feel like now more providers are open to that. And some of them are not, and are simply like, nope, none of that stuff works. You need medication. And those are more of our old school, but have that conversation with them. The other thing is making sure we're giving it time. When we are changing things, it's not like we are overnight going to be seeing responses. And that's the one thing I think that parents get frustrated with is they want that quick fix like medication does. And it's usually with stimulants. I mean, it can be as quickly as a few hours. It can be a couple of days, and you're not going to get that. When you're talking about a lifestyle change, it can take weeks to months to really show the full effects. And you have to remember though, this is what makes it more sustainable because you're healing from the inside out. And so remembering to allow yourself the grace, allowing your child the grace to say, okay, we're committed to this. We want to make sure that you are able to live your best life and really be fully committed. And again, also remembering that kids can go to birthday parties. They can have that treat once in a while, but as long as we're being generally fully committed to a lifestyle, you're going to see improvements. I'm not saying that your kid can't still be a kid. They can't participate in the different activities of the day-to-day kid things. That's okay. So remember also that not every intervention works with every child. This is why it's important to not do a standardized blanket. You've got to do things that are specific and individualized testing. And this is why it's so super important with our kiddos, because when we're looking at each child individually, it helps really get to the core of what's going on with them and what's actually causing their symptoms so that we're able to heal them. So remembering that that's also super important for our kiddos. So if you are interested in exploring some natural alternatives to ADHD medication for your child, I would love to help you. In my functional psychiatry practice and coaching, I use the comprehensive testing to identify exactly what your child needs. And then we help create personalized protocols that really address the root causes for your kiddo. And you can find the link below to schedule your consultation. And on that call, it's a free call. We can chat about, hey, like what's going on, some concerns that you have, see if there's something that I'd be able to help with, talk about your specific situation, things that you've tried, and really just kind of discuss how functional psychiatry can help you. And so remember that ADHD medications can be a helpful tool. I'm not discounting that, but they're not the only option. So when you're addressing things like nutrient deficiencies or healing the gut or optimizing lifestyles and supporting your brain or your child's brain function naturally, many kiddos can actually lower their medications or even stop taking medication altogether and really have the same benefit of that. Every child deserves a comprehensive approach to really just kind of address with the issues that they're struggling with and not just the symptoms that they're showing, right? So if you found this video helpful, please like and subscribe for more information and more context about natural approaches to children's mental health. And thank you for watching, and I'll see you guys in the next video. Have an amazing day.